good doctor should be able to talk to his patients, listen to them more importantly, and give him his time. Try to figure out what's really wrong with them. Besides their medical complaint, the patients usually have a lot to talk to the doctor about because they trust him and they trust his knowledge and his confidentiality. So he should really give him his time and try to listen more to the patient.
I think that a good doctor would really just care out and focus on helping his suffering patients. And also in rural areas there's a huge lack of medical staff and medical manpower. It would be a really good idea for doctors to once in a while just visit these areas and help those people in need, because they really need help while in rural areas are just low.
Well, even if he was a good doctor, he shouldn't be arrogant to the patient and even superior to him.
A good physician or a good doctor should always be able to make the general public aware of any diseases spreading that could harm them. Just sort of public awareness campaigns, for example, making posters, writing articles, maybe going on talk shows, or even like any way just to make the public aware of any disease spreading that could harm them. Also give them information about medication, methods of treatment, and how to basically stay away from it.
I believe a doctor should be friendly and professional at the same time. This serves better communication between the patient and the doctor, both in terms of receiving accurate information and delivering proper advices or what the doctor wants really from a patient.
Okay, a doctor should be a role model in his society. So let's say, for example, if a doctor smokes and some patients will see him, this will give him an argument or just to say, okay, if this doctor will smoke, why shouldn't I? Okay, so the doctor should reconsider his action, especially his bad habits. Another point I would like to make that each doctor, especially those who have specialties or have experience, should adopt one of the younger generation of doctors to make a mentor of himself and to train and to guide this young doctor to be like him. And by doing this, we are creating a new norm or a new, let's say, habit for the generations to adopt and to relearn by themselves.
I think for community service, every doctor that owns a clinic should at least make one of the days of the week a free clinic day, in order to help all people who can't pay for healthcare to receive